The 7 best vitamins for strong and healthy legs. Imagine waking up every morning feeling light on your feet, confident in your movements, and energized for the day ahead. No more worrying about weakness, cramps, or the fear of losing your balance. To avoid these consequences, it's crucial to monitor your vitamin D levels and replenish them as needed. The most natural way to do this is to spend 15 to 30 minutes in the sun with exposed arms and legs, preferably in the morning or evening. However, it's important to note that sunscreen can interfere with vitamin production. Another option to include in your diet is foods rich in vitamin D, such as fatty fish, like salmon, mackerel, or sardines, legumes, fortified dairy products, egg yolks, and mushrooms. While it's challenging to meet the daily requirements solely through food, these items can help maintain adequate levels of vitamin D. Many elderly individuals, especially those who rarely go outside, require additional vitamin D. It's generally recommended to take a dosage of 800–1,000 IU per day, and in cases of severe deficiency, a higher amount may be necessary, but it's important to consult with a doctor in such circumstances. To determine if you need vitamin D, you can have a blood test done. More and more doctors are offering this test to older adults to help reduce the risk of falls and fractures. As we age, bones become less dense, increasing the likelihood of fractures. This is especially true for the legs. Hip fractures and other injuries to the lower limbs are among the most severe injuries for older adults. Sometimes even a minor fall can lead to a long recovery process or loss of mobility if the body lacks calcium. But calcium is important not just for strong bones. It is essential for our muscles to contract. Without it, we can't take a step or even stand up from a chair. When there is a calcium deficiency, muscles can cramp, become weak, and tire quickly. Calcium deficiency often leads to cramps, slower movements, and muscle fatigue. You can replenish calcium not only through dairy products like milk, yogurt, or cheese. Leafy greens, such as kale and bok choy, almonds, tofu, sardines, and fortified plant-based drinks are also rich sources of calcium. It's best to combine different foods to enhance calcium absorption. Sometimes, food alone isn't enough, especially if there are dietary restrictions or issues with calcium absorption. In such cases, supplements may be necessary, particularly when taken alongside vitamin D, which aids calcium absorption. However, it's important not to go overboard. Too much calcium, especially from supplements, can lead to kidney stones, vascular deposits, and digestive issues. Adults and seniors are generally advised to get 1,000 to 1,200 milligrams of calcium per day, preferably from a variety of natural food sources, and to use supplements as needed. Physical activity is another crucial factor. Regular physical activity, whether it's walking, strength training, or light jogging, helps bones regenerate and ensures that calcium is directed where it's needed most, in the bones and muscles. If you're not active, even a proper diet with sufficient calcium won't yield the desired results. A lack of calcium makes bones brittle, which limits mobility, hinders engagement in favorite activities, and reduces independence. Strong bones and muscles are the foundation of an active and confident life, but this is only possible with adequate levels of calcium. Typically, when discussing leg strength, people think of calcium and protein, but rarely do they consider the role of vitamin B12. However, it is essential for the proper functioning of the nervous system, as it helps transmit signals from the spinal cord to the legs. If you want to stay active, maintain independence, and feel confident, nutrition plays a crucial role. Here are 7 vitamins and minerals that can help keep your legs strong and resilient. They support muscle and bone health, improve circulation, and overall help you feel your best. A deficiency in vitamin B12 can lead to muscles not responding well, resulting in weakness, instability, and a feeling of heaviness or fatigue. Sometimes there may even be numbness or tingling. This deficiency is particularly common among older adults. Vitamin B12 differs from other vitamins in that its absorption heavily depends on the condition of the stomach and intestines. For this vitamin to enter the bloodstream, sufficient acidity in the stomach and a special protein called intrinsic factor are needed. As people age, stomach acidity typically decreases, and conditions like gastritis or reflux, as well as long-term use of heartburn medications, make it even harder to absorb B12. Additionally, older adults often consume fewer foods rich in this vitamin, leading to gradually depleted stores. A deficiency in B12 is concerning not only because it can cause weakness and fatigue. Lack of this vitamin can lead to serious nerve issues. Balance and coordination are affected, and reflexes may become slower. As a result, some individuals may experience frequent falls, difficulties with walking, and a sensation that their legs aren't responding properly. This is often related to a deficiency of B12, rather than just aging. When vitamin levels are restored, individuals typically experience noticeable improvements in mobility and an increase in strength. Research shows that after addressing the deficiency, elderly people have more energy and endurance, and their legs function better. Vitamin B12 is found almost exclusively in animal products, including lean meats, fish, eggs, dairy products, and seafood, particularly liver and shellfish. For those who don't eat meat or have absorption issues, it's better to choose products fortified with B12 or take vitamin supplements. Vitamin B12 is considered one of the safest vitamins. If there is too much in the body, it is simply excreted in urine. Older adults are often advised to take high doses of B12 supplements or receive periodic injections, especially if they have issues absorbing it from food. It's possible to check the level of this vitamin through a standard blood test to catch any decline early and prevent deterioration in leg function. After all, leg strength relies not just on muscles, but also on how well the nerves are functioning, how quickly a person can react, and how coordinated their movements are. If nerve impulses are not transmitted effectively, even the most rigorous training won't yield the desired results. Therefore, maintaining a normal level of B12 is a simple yet often underestimated way to preserve mobility and quality of life as we age. Magnesium also plays a crucial role. Without it, muscles simply cannot function properly. Every time you take a step, magnesium helps your muscles contract and relax properly, protecting against cramps, reducing fatigue, and supporting endurance. One of the most common yet lesser-known signs of magnesium deficiency is restless leg syndrome and nighttime cramps. Many elderly people are familiar with sudden, painful leg spasms at night that disrupt sleep and recovery. This is not just an inconvenience. It's the body signaling that it lacks magnesium for muscle relaxation. Magnesium plays a crucial role in maintaining strong bones and joint health. Without it, calcium cannot perform its job properly. Magnesium ensures that calcium gets into the bones instead of settling in soft tissues, where it can cause stiffness and joint pain. Research shows that adequate magnesium intake strengthens bones and significantly reduces the risk of fractures in older adults. Often, magnesium deficiency is linked to stress, the use of certain medications, such as diuretics, acid-reducing drugs, or antihypertensives, and poor nutrition. When the diet lacks magnesium-rich foods, deficiency becomes quite common. This information will be useful for anyone who enjoys long walks, dancing, or simply wants to maintain their independence. Vitamin D. As we age, our bodies inevitably change. Muscles weaken, bones lose strength, and everyday movements become more challenging. It can subtly diminish strength, endurance, and flexibility. As a result, many older adults find themselves getting tired more quickly, walking more slowly, struggling to climb stairs, and losing their previous level of activity. Fortunately, addressing magnesium deficiency can often be done relatively quickly. Many people notice that cramps subside, energy levels increase, and movement becomes easier. The highest amounts of magnesium can be found in leafy greens, nuts, seeds, whole grains, and legumes. Pumpkin seeds, almonds, spinach, black beans, and avocados are particularly rich in magnesium. If it's difficult to get enough magnesium through food, supplements can be an option. It's best to choose magnesium in the form of citrate or glycinate, as these are well absorbed by the body. When magnesium levels return to normal, many older adults report relief from cramps, improved mobility, better sleep, and an overall enhancement in well-being. Magnesium plays a crucial role in ensuring that our nerves and muscles work together smoothly, which helps improve coordination and balance. If you've ever woken up at night due to a calf cramp, it's likely that your body is lacking potassium. This element is responsible for muscle function and regulates the amount of fluid inside and outside of cells. When potassium levels are low, muscles can suddenly contract, leading to painful cramps, especially in the legs. For older adults, these cramps are not just a minor annoyance. They can be a serious issue that hinders normal movement and daily life. However, cramps are just the first warning sign. Potassium is essential for communication between the brain and muscles, so when it's lacking, movements can become shaky or uncertain, and individuals may experience weakness or difficulty lifting their feet. All of this increases the risk of falls. Potassium helps keep bones strong by reducing the breakdown of bone tissue. When your diet includes enough potassium, your bones lose density at a slower rate, which lowers the risk of osteoporosis. Here's how to ensure you're getting enough potassium. To get enough potassium, you don't have to rely solely on bananas. There are plenty of delicious and nutritious foods in nature that contain even more of this mineral. For example, sweet potatoes, avocados, spinach, legumes, and oranges are all excellent sources of potassium. Even a regular baked potato with its skin contains more potassium than a banana. The key is not to fixate on one single food, but to keep your diet varied. This way, your muscles and bones will get all the nutrients they need every day. Adult women typically need around 2,600 milliliters of potassium per day, while men need about 3,400 milliliters. Generally, it's easy to meet these needs if your diet includes plenty of vegetables, fruits, and legumes. However, if you have kidney issues or frequently experience high blood pressure, it's best to consult with your doctor about the optimal amount of potassium for you. Vitamin K. When it comes to bone health, calcium and vitamin D often steal the spotlight. However, without vitamin K, they can't perform their roles effectively. One of the main reasons for this is a deficiency in vitamin D. It's not just about bone health. Vitamin D plays a crucial role in maintaining strength, balance, and mobility in the legs. It's especially important to monitor your levels as you reach middle age and beyond. Vitamin K helps calcium get into the bones rather than settling in the blood vessels and other soft tissues, where it can disrupt normal blood flow and even contribute to cardiovascular diseases. You can think of vitamin K as a dispatcher, directing calcium precisely where it's needed, which helps maintain strong and flexible legs. This is particularly crucial for older adults. When there's enough vitamin K in the body, bones become stronger, the risk of fractures decreases, and overall bone health improves. Vitamin K activates a special protein called osteocalcin, which helps calcium bind to bone tissue, making bones denser and more resistant to damage. But the benefits of vitamin K don't stop there. It's essential not only for bones, but also for joints and muscles. Vitamin K helps reduce inflammation in the joints, which can slow the progression of osteoarthritis and alleviate stiffness, especially in the knees, a common issue among the elderly. If your knees hurt when you move or feel stiff after sitting for a long time, it might be a sign that your body is lacking this vitamin. Additionally, vitamin K supports muscle strength and coordination. It regulates calcium levels within muscle cells, ensuring that muscles contract properly, which reduces the risk of unsteady movements that can lead to falls. The highest amounts of vitamin K1 can be found in spinach, kale, Swiss chard, and both leaf and Brussels sprouts. Vitamin K2 is present in fermented foods such as natto, aged cheeses, as well as in eggs and liver. K2 is particularly valuable because it stays in the body longer and helps direct calcium into the bones rather than depositing it where it shouldn't be. To boost your levels of this vitamin, make a point to eat more green vegetables and fermented foods. Even a glass of green smoothie or a serving of sautéed spinach can significantly improve the situation. If you're having trouble absorbing vitamins from food, such as with gastrointestinal issues or after a long course of antibiotics, you might want to consider supplements. However, it's essential to consult with a doctor before starting any new supplement, especially if you're taking blood thinners like warfarin, since vitamin K can affect clotting. Vitamin B6, or pyridoxine, is much more crucial for leg strength and muscle function than many people realize. It plays a vital role in maintaining healthy nerves, muscle recovery, and ensuring that protein benefits the muscles instead of just passing through the system. If you're low on B6, even the strongest muscles can weaken over time, making everyday movements like standing up or climbing stairs increasingly difficult. One of the key functions of this vitamin is to support nerve function and coordination. If Michael levels are low, signals between the nerves can slow down or become erroneous, leading to symptoms like numbness, tingling, and unsteady gait. Many people mistake these symptoms for something ordinary. As people age, their skin becomes less capable of producing vitamin D in response to sunlight. Additionally, many older adults spend less time outdoors due to mobility issues, changes in habits, or concerns about skin health. This often leads to a deficiency in vitamin D, which can subtly reduce muscle strength. Legs become weaker, and instability may arise. Numerous studies confirm that a lack of vitamin D is directly linked to muscle weakness and an increased risk of falls among older adults. For instance, Data from the Journal of Clinical Endocrinology and Metabolism indicate that those with normal levels of vitamin D have stronger muscles, better coordination, and improved balance, resulting in a lower likelihood of injury or fractures. Conversely, when vitamin D is insufficient, muscle strength declines more rapidly, making even simple tasks like climbing stairs or getting up from a chair challenging. Vitamin D is essential not only for bone health and calcium absorption, but also plays a direct role in muscle function. It aids in protein synthesis and supports the proper functioning of the neuromuscular system. This vitamin is particularly important for fast-twitch muscle fibers, which are responsible for quick reactions and maintaining balance, thus helping to prevent falls. When there is a deficiency of vitamin D, muscles start to work more slowly, contract less effectively, and the risk of injuries increases. Additionally, vitamin D helps reduce inflammation in the muscles, alleviating chronic pain and discomfort in the legs that often trouble older adults. If you frequently experience cramps, stiffness, or unexplained pain in your legs, it may be a sign that your body needs more vitamin D. A deficiency in this vitamin can lead not only to weakness in the legs, but also to more serious issues, such as osteoporosis and fractures. When there is insufficient vitamin D, calcium absorption becomes impaired, bones become brittle, and even a minor fall can result in a serious injury. Additionally, a lack of vitamin D increases the risk of cardiovascular diseases, memory problems, and weakens the immune system.